Welcome to the Your Cancer Journey Handbook, part of the Cancer Survivors Toolkit program. For more details on this program, please visit www.cancersurvivorstoolkit.com. Equipping you and your loved ones for the journey ahead. Written and narrated by Gary Barker, the creator of the Cancer Survivors Toolkit. Introduction. Cancer is probably the toughest fight any one of us could ever come up against. Just saying the word or contemplating the condition can cause even the hardiest of us genuine twinges of horror. However, the fact is, 1 in 3 of us will at some point in our lives develop a form of the disease. This equates to 300,000 new cases a year in the UK and 1.5 million a year in the USA. And these figures are increasing each and every year. So let's be honest here, whether we like it or not, cancer is directly or indirectly going to affect each and every one of us in some way during our lifetime. Being diagnosed with cancer can understandably be a totally overwhelming experience, with many sufferers psychologically unable to cope, or living in such denial that they allow a totally treatable minor cancer to go untreated with potentially devastating consequences. However, there are also many cases of individuals with the most destructive cancers who completely stun the medical profession by combating their disease or far exceeding their life expectancy by many years, sometimes even decades. These people are without exception very positive, upbeat, and remain psychologically intact, and as such they enjoy a far better quality of life. They appear to suffer less pain, recover more quickly, and take their treatment in their stride, to the extent that they are often selected as guinea pigs by the pharmaceutical giants for up-and-coming cancer treatments. Why? Because their mindset is conducive to a positive drugs trial. At the present time, there isn't too much out there to help cancer sufferers psychologically deal with their condition. In the UK, the charitable organisation Macmillan is at the forefront of cancer care and does a superb job of offering counselling for both sufferers and their loved ones alike, but unfortunately not until the later stages of the illness. The Cancer Survivors Toolkit is here to fill that void, to offer cancer sufferers and their carers a psychological crutch that assists them at every stage of their cancer journey. In today's modern world, we've virtually turned our backs on the mind-body connection, and now, without exception, when we are ill, we resort to a pill, a medicine, an injection, or any other form of external fix. Yet up to as little as 100 years ago, healing was viewed as a 3-way fix that included mind, mindset, and medicine. The Cancer Survivors Toolkit is here to allow cancer sufferers to exercise that 3-way fix by teaching them to participate in their recovery rather than just surrendering themselves to modern medicine and hoping for the best. So how does it all work? Well, each of us is equipped with an extremely powerful and potent natural defence to illness and disease, our immune system. This cancer guide will explain to you how stress and poor lifestyle reduce the effectiveness of our immune systems. It will also show how for some individuals there are unexpected links between suppressed major life traumas, which can also reduce the effectiveness of the immune system and potentially allow disease to manifest itself. So if that's the case, and stress reduces the effectiveness of the immune system, if cancer sufferers can somehow find a way to reduce their stress levels, they should then be able to relieve not only the immediate cancer stress, but also any other underlying stresses that made them susceptible to cancer in the first place. As these stresses go down, the effectiveness of their immune system will increase. If this is then used in conjunction with a positive mindset, a healthy lifestyle, and the latest modern medicine has to offer, we are then really giving cancer sufferers the best possible opportunity to participate in recovery rather than drown in despair by focusing on the negative side of their situation. This guide will explain to you what cancer is, how life events, personal traits, stress and poor lifestyle can all allow cancer to take a hold. We'll then look at the psychological side of the illness before we work through the program and all its varied modules. At the end of this guide, you will be an expert in your understanding of cancer and how to best confront it, whether you are the loved one looking to help a friend, a family member or partner, or the cancer sufferer yourself. This program is broken down into individual modules. This means that the Cancer Survivors Toolkit as a program can be adapted and administered to any cancer sufferer at any stage of their illness. At the start of each module is a list of the aims we hope to achieve. Then we'll move straight on to the main body of that specific module. At the end of each module is a list of the videos that complement that section. As for many, a visual representation of something is far more memorable than written text. This is then followed by any exercises that may be of benefit. After that, you can then move on to the audio recordings. Access to the members area of the website can be gained here, www.cancersurvivorstoolkit.com. So please take your time with this guide. It really is here to allow you to understand what your choices are, what you're up against, but more significantly, how important your role is in this fight. It doesn't matter whether you are caring for someone with cancer or the sufferer yourself. You both have a vital role to play in this up and coming journey. What is cancer? This section is all about explaining and demystifying this disease. At this point, it isn't necessary to know everything there is to know about cancer, because this guide isn't a guide to medical conditions or practices. That is for you to discuss with your medical team, and notice I said medical team. Well, it's important that from now on this is how you view them. They are your team. They are there to serve you. This section is divided up into 4 parts. A description of the disease, the basic types of cancer, tumours and blood cancers, the stages of cancer, and the medical treatments. The human body is made up of approximately 10 trillion individual cells. These cells make up every part of our being and are in a constant state of growth, replication and demise. And all this happens in a very ordered, systematic and natural way. As a cell dies, it is immediately replaced with a new one, and this process happens billions of times a day without any conscious input from us whatsoever. Cancer occurs when that cell division and replacement becomes erratic. Rather than the cells multiplying logically, they overproduce, or instead of cells dying, they mutate and become abnormal cells. These abnormal cells then have the capability to reproduce quickly and overtake other cell structures. These rogue cells are then termed cancerous. However, this seemingly horrendous twist of fate happens to each and every one of us every single day. Rogue cells develop, but are then destroyed almost instantly by the white blood cells of our immune system, but only if our immune system is strong and healthy. Watch Video 1, Role of the Immune System in Cancer. Stress and lifestyle, as we will see, can have a major effect on our immune system's efficiency. For example, smokers contracting lung cancer and alcoholics contracting liver cancer. Watch Video 2, White Blood Cells. Another point of major interest is the fact that biologically, these rogue cancer cells are actually a lot less robust than normal healthy cells, and they only become a problem if they are then allowed to multiply unchecked. When this happens, these cells can form into a tumour, or into a cancer of the blood, like leukemia. If these cancerous cells are then allowed to reproduce, they can manifest themselves in a number of different ways. Types of cancer. 1. A benign tumour. This is a group of cancerous cells that grow and form a tumour, but don't invade or overtake other tissues. Benign tumours can, however, grow in size and press on other internal organs, causing illness and discomfort. Benign tumours are not life-threatening, and treatment generally consists of surgical removal or radiotherapy. 2. A malignant tumour. This tumour starts out much the same as a benign tumour. However, this tumour contains cells that are more aggressive and destructive. These rogue cells invade and destroy healthy cells and dominate the tissue. This kind of tumour can be surgically removed or treated with radiotherapy and followed up by chemotherapy. 3. Metastasis. This is the name given to cancer cells that form in a malignant tumour and then break off and flow through the bloodstream or lymphatic system, and then start a new tumour somewhere else in the body. The interesting thing is that although there are over 200 different types of cancer known to science, wherever that cancer originates is the cancer type, no matter where else it may present itself in the body. So, if the primary site of a malignant tumour was in the liver, and that cancer then metastasises to the lung, the tumour in the lung will still be recognised as a liver cancer. This condition is normally dealt with using surgery first to remove the main cancers, and then chemotherapy to destroy any other rogue cells that remain. Obviously, having an immune system full of vicious, active, hungry white blood cells would be most beneficial with this type of cancer. 4. Blood cancers. Leukemia and myeloma are cancers that start in our bones. Lymphoma is a cancer that occupies the lymphatic system, the system that filters our blood and keeps our immune system healthy. These cancers don't normally form tumours, but instead flow around the body. This type of cancer stops the production of the body's blood cells and interferes with the body's ability to fight infection. Treatment for this cancer has improved greatly over the years, with chemotherapy being the most common method. The important thing to remember here is that cancer cells are weak and disorganised, and that our bodies are extremely good at dealing with them when our immune systems are fit and healthy. Stages of cancer. The severity of cancer is measured in 5 stages, primarily using the TNM system. The TNM system is an abbreviation and includes the following information: tumour formation T, lymphatic node involvement N, and presence of metastasis M. This extract on the stages of cancer can be found at www.livestrong.com. Watch Video 3 Stages of Cancer. Stage 0. The earliest, most treatable form of cancer are Stage 0 cancers, though this staging level is not applicable to all forms of cancer. During this stage, abnormal cells are only detected within the top layer of cells within the affected body region. Such forms of cancer are often referred to as carcinoma in situ, which means that abnormal cells are localized at the site where they originated. For example, Stage 0 breast cancer means that abnormal cells are only detectable within the cells that line the breast duct or lobules. Stage 1. When abnormal cells clump together and begin penetrating beneath the top layer of the cells within the organ of origin, they can form Stage 1 cancer. This stage of cancer describes cancer that is small and present only within the organ of origin. Due to these characteristics, Stage 1 cancer is typically very treatable and has a high cure rate in the majority of cancer patients. Stage 2. Stage 2 cancer occurs when cancerous cells begin to grow into a small tumour within the organ of origin. Typically, cancer in this stage has not spread to other tissues or organs within the body. In certain people, cancerous cells that spread into nearby lymph nodes may be classified as Stage 2 cancer. Stage 3. As the cancer grows, it can begin to spread into the lymph nodes and surrounding tissues. When this occurs, the cancerous tumour is characterised as Stage 3. Stage 4. Stage 4 cancer develops when the cancer cells spread from their point of origin to another organ within the body. This stage of cancer is also referred to as metastasis or secondary cancer and is the most advanced form of the disease. Medical treatments. There are basically 3 types of medical treatments for cancer, although each method is almost a science in itself, with a myriad of techniques and specialised treatments available. We'll just be dealing with the 3 main types here, which are 1. Surgery. This treatment simply means an operation to surgically remove a localised tumour that is either benign or malignant. This is also the most effective way of confirming or assessing the extent of the sufferer's condition. 2. Radiotherapy. This treatment involves the use of high-energy X-ray beams that are fired directly at the cancerous cells, generally from multiple points that concentrate on the affected area or areas. These X-ray beams then break down and destroy the tumour from the inside out. This treatment is generally given in small doses of 10 to 20 minutes a session over a matter of days and weeks. Radiotherapy is virtually painless and the side effects minimal. Watch video 4, Radiotherapy treatment. 3. Chemotherapy or chemical therapy. Administered in a series of sessions, either orally, directly into the body via injection, drip, or topically using a cream. The chemicals used are obviously caustic by nature, but as we already know, because the cancer cells are structurally much weaker than healthy cells, the healthy cells repair, but the cancer cells can't and they die. This treatment is carried out over a period of time, with each session being followed up with a rest period before the patient continues. Chemotherapy is used in 2 ways: to either destroy the cancer cells as an aid to full recovery, or being used to reduce the number of cancer cells, giving the sufferer a longer life expectancy. As we are all aware, chemotherapy can result in more severe side effects. The reason for this is simply because the cells that make up our bone marrow, hair follicles, the lining of our mouth and digestive system are more sensitive to this treatment, with patients sometimes, but not always, experiencing some of the following: temporary hair loss, sickness, mouth ulcers, and general feelings of nausea until the healthy cells recover. Watch video 5, Chemotherapy treatment. What you have here is a general outline of what cancer is, how it develops in the body, and the medical treatments available. Unfortunately, there isn't enough space or time to describe every variation, or to go into this subject in too much depth. The information supplied here is a guide, and if you wish to know more, the internet is an absolute goldmine of information. However, please be aware that your doctors and consultants are your primary source of information. Information found on the internet can be either inaccurate or totally misleading, so common sense needs to prevail. Cancer, stress, and the immune system. So now we know a bit more about cancer and its treatments. Let's now start digging a little deeper. Cancer cells, as we already know, are a common byproduct of our body's regeneration, and they are dealt with in a systematic way by our body's NK cells, natural killer cells. These are found in the white blood cells of our immune system. An NK cell is our body's equivalent to a hungry piranha or an arcade game Pac-Man. Their function is to latch onto rogue cells, viruses, and bacteria. Once these rogue cells are encountered, the NK cells then multiply, overcome, and destroy any threat until normal service is resumed. For example, if that threat is in the form of a bacteria found under the skin on our face, or from an invader like a small splinter, this battle between invader and NK cells will be recognisable to us in the form of a spot on our face, or a red sore that when squeezed will produce pus. So our immune system is an extremely strong, aggressive, adaptable force. This must then beg the question, if our immune systems are so powerful and cancer cells are being produced and destroyed on a regular basis, how and why do we then develop serious life-threatening illnesses such as cancer? What changes to allow disease to take place? Well, the answer is simple. Our immune systems weaken when we are stressed. If it becomes sufficiently weakened, cancer cells can go unnoticed and then form benign or malignant tumours. But let's be clear, there is no definitive cause for cancer. Old age is obviously a major factor. As our bodies age, our body function degrades. Some cancer is hereditary, i.e. in the genes. Some is due to pollution and contamination, such as asbestos and radiation. And of course, a sedentary, stressed or unhealthy lifestyle will also have a major impact. In fact, according to the latest figures from the World Health Organization, 70% of all cancers are attributed to poor diet and lifestyle, and are totally preventable. So it makes sense then that having a tip-top immune system is vital if we are to remain healthy and evade illness. If we were then unfortunate enough to find we were suffering with an illness, especially something as scary as cancer, seeking the best possible medical treatment and restoring our immune system to its optimum performance would be of paramount importance for both our long and short-term well-being. So now you're probably saying, okay, yeah, I get the gist. But what does stress have to do with all this? Well, quite simply, stress suppresses the immune system. Stress stops the production of the NK cells, the piranhas and Pac-Man that keep us disease-free. Let's get something straight here. We are not talking about life's daily stresses or hassles. We are talking about chronic stresses, major stresses that have a major impact on our bodies, our psychologies and our immune system. Simple question. When do we find the majority of us get colds, coughs, flu, tonsillitis, IBS, earaches, etc.? Answer: when we are run down and stressed. These may be the times when we are working too hard, studying for exams, having a rough time in a relationship, or not finding the time to relax sufficiently. At these times, our body secretes a hormone called corticosteroid. This is simply a stress hormone that regulates our stress and immune responses. Basically, to cut a long story short, this hormone suppresses the effectiveness of the immune system by reducing the lymphocytes in our blood, which in turn produce white blood cells. In other words, when we are stressed, our immune system becomes distracted, leaving us vulnerable to illness. If the stress is mild, then generally what happens is something like this. We get a cold or feel run down, we rest, we get better, and our immune system recovers. However, if that stress is major, either in intensity or takes place over a period of many years or both, we could really be leaving ourselves open to disease. And this isn't only cancer, it could be any form of disease. Not only that, we also need to consider that many of us react in unhealthy ways to stress and anxiety by using food, tobacco, or alcohol as medication. This can also have an indirect effect on our immune system. If all this sounds a bit far-fetched, let's now apply this to the world we live in. Let's look at some real-life scenarios we've all heard of or experienced firsthand. How often have you heard the tale of the businessman who worked hard his whole life through and never suffered with a day's illness. He was very successful and appeared very happy. Then 18 months after he retired, he contracts cancer. How about the old age pensioner whose lifelong partner dies and then 6 months later develops terminal cancer and joins their partner soon after? How about the long-lost friend or acquaintance that we may meet in the street who rattles off what a terrible last 2 years they've had? Their story generally goes something like this. Well, I found out my partner was having an affair with my best friend, and they left me. Then I lost my job. Then I had a car crash. Then I found out I'd got cancer. Prolonged or intense stress doesn't produce cancer or illness in itself. What it does is lower our body's ability to defend itself as well as it could. It allows those rogue cells, that virus, that bacteria to get a hold and then multiply. The reason, when we are stressed, we aren't producing enough white blood cells to police and destroy invaders properly. 100 years ago, the mind and body were viewed as a joint system that worked together. They both influenced our health and well-being. However, because psychotherapy and matters of the mind are very individual and treatments difficult to adequately quantify, measure and replicate, medicine instead has become the mainstream treatment for all physical ailments, and the body-mind connection has been largely discounted. Watch video 6, Understanding Stress and Disease. Today, the medical profession views mind therapies with a large amount of skepticism. As such, to suggest to a medical physician that a cancer sufferer was ill because of long-term or chronic stress would be viewed as fantasy. However, if you have so far grasped the principle of stress and the effect it has on our immune system, let's take this a step further. There is a train of thought that suggests a series of major emotional traumas can indeed deplete the immune system to such an extent that within 6 to 8 months of that trauma, cancer may present itself. And would you believe these stress levels can actually be quantified using the Social Readjustment Rating Scale, or more commonly called the Holmes and Rahe Stress Scale? You'll find this on the accompanying PDF. So how does it work? Well, on this scale are listed life events in one column, and in the next column each event is given an event rating from 0 to 100. It's suggested that individuals that have endured life events that add up to over 300 units are at much higher risk of disease. Those that range from 150 to 200 are at moderate risk of developing an illness, and those below 150 have only a slight risk. Please note, this information is not meant as a test. This is just research that you can conduct and correlate for yourself. Please note as well that no two individuals react the same way to stress. The loss of a spouse may be absolutely catastrophic to one individual. However, to someone else whose marriage was loveless or abusive, well, the truth is they may genuinely feel relieved. So their stress rating would be considerably less. That's why this scale is for research purposes only. Another point of interest is that chronic stress is encountered in different ways. The businessman we mentioned earlier, who worked hard his whole life and then after retirement contracted cancer and died 18 months later, how could this theory apply to him? Well, let's make a few assumptions about that businessman. Let's say that his conditioning as a child and young man was to work hard and to be a winner. His whole life he fulfilled his conditioning. He may have worked long hours and been a hard taskmaster. However, the fact is, he was working within his comfort zone. His stress levels were generally very low. Then he retires, he hands his empire over to his sons, and goes heading off into the sunset to play golf and sail his boat. This should now be his time to reap the rewards of his labour. Instead, he finds he is all of a sudden completely outside his comfort zone and conditioning, and he subconsciously finds himself in a chronic stress situation. In fact, some studies suggest that certain personality traits seem more susceptible to chronic stress and subsequent illness than others. These personality types are generally life's pleasers. Their upbringing and conditioning means they hold it all in. They endure personal hardship but never complain. They don't stand up for what they believe. They bottle it all up. They feel emotional but cannot vent their emotions. They are life's pleasers. They find it very difficult to say no, to stand up for their opinions and their rights. They are easily taken for granted, which once again just reinforces their conditioning. These lovely, caring, sensitive individuals live in a chronic stress environment that they often don't even realise. Watch video 7, Cancer as a Signal to Change. If we now apply our stress model, is it any surprise that these are the people that end up getting ill? If we are to believe the mind-body connection, then if an individual is not strong enough psychologically to say no to the stress environment, their body could make that choice for them with potentially devastating results. So now you have a better idea of the effects of stress on our bodies. What next? Well, the Cancer Survivors Toolkit's objective is to give every cancer sufferer the best possible chance to encourage that three-way fix: medicine, mindset and lifestyle, that when combined will help build a powerful motivation to mend and a positive expectancy at every stage of their cancer journey. How the Cancer Survivors Toolkit can help. The aim of the Cancer Survivors Toolkit is to offer cancer sufferers a legitimate caring program aimed at complementing the established medical treatments. Research has shown that psychological care for cancer sufferers is sorely lacking. Macmillan is the main cancer care service in the UK, and they do an absolutely wonderful job providing a wealth of information and help to cancer sufferers and their families, and I'd advise you to look at their website www.macmillan.org.uk. It really does answer a lot of the questions we all have regarding cancer, treatments and therapies. But obviously, being a charity-funded organisation, it doesn't overly promote alternative or complementary therapies as a treatment. The fact is, research has shown over and over that reducing fears and anxieties at every stage of the illness reduces the patient's suffering, along with increasing their optimism and the effectiveness of their medical treatment. So there seems to be a place for a well-structured psychological program to aid cancer sufferers and their plight. Remember, the Cancer Survivors Toolkit is not an alternative treatment, but a complementary program designed to meet the sufferer's needs at every stage of their illness. The Cancer Survivors Toolkit's ethos is to encourage a positive will to live. It's vitally important carers and sufferers alike take ownership for their recovery and not just blindly hand themselves over to the medical profession, keeping their fingers crossed, hoping some outside force will mend them. The Cancer Survivors Toolkit is about assisting cancer sufferers to meet their own individual objectives. The unfortunate fact is that some cancer sufferers may not wish to recover, but just comfortably accept their diagnosis. Some cancer sufferers will decide to build a team and a strategy and fight as hard as they can. It's important to remember cancer is a frightening condition, and that every sufferer will be scared and desperate for answers. They will want to talk after the initial shock of their diagnosis has passed, to offload, to build hope, acceptance and strength, and to give themselves the best possible opportunity they can to overcome their condition. As we know, a positive mental attitude can achieve great things. So what and how can the Cancer Survivors Toolkit help? Well, this program is designed to show you how our mind acts on our body, and how our body acts on our mind, how stress in the immune system, both from long-term stress or a series of recent major psychological traumas, can lower the immune system's effectiveness, allowing disease to manifest itself. The Cancer Survivors Toolkit is designed to help restore the psychology of the sufferer with a positive mindset that will aid the immune system, which in turn will aid the comfort, acceptance and recovery of the sufferer. Basically, the Cancer Survivors Toolkit is asking the sufferer to engage and participate in the recovery and not drown in despair. The fact is, cancer sufferers need to employ an all-encompassing assault against their cancer, including not only mindset but also lifestyle changes in the form of diet and exercise. These will allow them to develop a positive physical and psychological environment. If this is then aligned with the best modern medicine has to offer, the sufferer will then be giving themselves the powerful three-pronged approach we mentioned earlier. But how do we achieve this? Well, the Cancer Survivors Toolkit is broken down into different elements that comprise this guide, plus 8 individual audio recordings, lifestyle information handout, and selected videos contained on the website. Each module has been developed to assist the sufferer at each stage of their illness, and can be referred to as often as the sufferer or carer desires, such as the positive treatment module that includes positive visualization regarding medical procedures, and can be administered each time the sufferer goes into hospital to receive treatment. The Cancer Survivors Toolkit is divided up into 4 modules. Each module is designed to deal with a different aspect of the condition. The program modules are broken down as follows. Module 1. Offloading and relaxing. It goes without saying that anyone who is diagnosed with cancer is going to feel like they've been hit by an overwhelming bolt out of the blue. And then there's the obvious knock-on effect to family, friends and loved ones. Whatever the circumstances, Module 1 is designed to encourage the sufferer to open up, to let that emotion out and to talk, to cry, to kick and scream. It's vitally important to vent those emotions in a caring environment that encourages them to do so. Included in this module is a relaxing audio recording that can be used by both the sufferer and the loved one. It's designed to relieve stress and worry, and of course regular listening is encouraged. Module 1B. Taking care of the carer. Module 1B is all about assisting, advising and raising awareness about how the carer can best serve the cancer sufferer. It's also about explaining the importance of the carer emotionally protecting themselves from what for them may also be one of the most traumatic events they've ever encountered. Module 2. Moving forward, building your team and taking control. Module 2 is about moving forward and motivating the sufferer to reach their objectives using positive visualization and lifestyle changes. The old saying, if you find yourself in a crocodile pit, it doesn't matter how you got in there, you better get out quick, springs to mind. Module 3. Viewing medical treatments positively and relieving discomfort. This module is all about positively preparing the sufferer for their medical treatment, removing anticipatory anxiety and helping relieve the psychological symptoms of perceived pain. Module 4. Reinforcement and surveillance. This module is for cancer sufferers who have undergone their medical treatment and have received positive results in the form of a remission or an all clear. Obviously they will be delighted but also very keen to continue their recovery or maintain their all clear. So in conclusion, the Cancer Survivors Toolkit is all about aiding the cancer sufferer and their loved ones, utilising various psychological techniques, plus a big old dollop of empathy and common sense. The modular approach of this program means the appropriate modules can be selected as and when required, depending on the patient's need. This program's primary aim is to benefit both the carer and the sufferer equally, because they are a team. Unfortunately, cancer is on the increase as lifestyles become more stressful and indulgent. It's important to appreciate the Cancer Survivors Toolkit is not a magic wand style program promising a wonder cure. It is a logical, well thought out and psychologically sound complementary therapy aimed squarely at positively assisting cancer sufferers and their loved ones through to a positive outcome. New chapter: The Sufferer. In our society, cancer is viewed very much as a taboo subject, which is strange because statistics show 1 in 3 of us will be diagnosed with a form of the disease during our lifetime. Even so, cancer is still a taboo subject, to the extent that when we first see somebody suffering with cancer, all we generally see is a cancer sufferer and not the individual. It's not uncommon for us to feel some anxiety and trepidation when faced with this situation, as we wonder how much this poor individual actually knows about the extent of their condition, or how they really feel about their mortality, or what their expectations for the future may be. This is of course completely normal, because subconsciously we don't know how to react or what to say, so we try and distance ourselves from it and hope it gets better somehow. The truth is of course that cancer sufferers are just normal individuals, normal people suffering with a medical complaint. They are obviously anxious, upset, scared and unsure about what the future holds. They may be angry or in denial, in fact in any number of emotional states. Some cancer sufferers may appear unusually happy and full of acceptance, which could be a genuine reaction or a massive dose of denial. The truth is we all deal with different situations in different ways. I urge you as either the sufferer or the carer to appreciate the taboo nature of the condition and to appreciate the large majority of people will have some difficulty knowing how to behave around cancer. As a carer and loved one, it's important to also remember it is not your job to take responsibility for the cancer sufferer's recovery. Carers are there to listen, to assist, and to care. So let's imagine our sufferers just received their cancer diagnosis. This diagnosis will probably have been a total bolt out of the blue, the result of something that was perceived as a minor symptom, a cough, a headache, a trace of blood, a bit of jaundice, a lump or localized pain. We already appreciate that being given a cancer diagnosis is going to emotionally floor us. So these are some of the most common responses to a cancer diagnosis. Maybe you'd completely fall apart and feel totally overwhelmed. Maybe you'd go into denial and think the doctors had made a mistake. Maybe you'd feel angry because you realised your lifestyle had finally caught up with you. Maybe you'd feel relieved and see cancer as a gift, an escape, because you could now get off the disappointing and unfulfilling roller coaster that was your life. Maybe you'd be very matter of fact, want to know all the details, and want to immediately start building a strategy to beat your condition. In each of these cases, we have an individual suffering to one degree or another with an emotional state that needs satisfying. For the majority of us, sitting across from a doctor or consultant, as they inform us we've got the big C, has to be the most frightening and lonely situation we'll ever face. Often doctors can be insipid about their diagnosis because they may not know the fullest extent of the diagnosis, so need to keep it vague. Secondly, it must be quite an unpleasant and uncomfortable task informing a patient of this potentially life-changing condition. From the patient's point of view, they've gone from feeling mildly ill to getting a cancer diagnosis. This is obviously going to knock them for six. Take into account as well that following their diagnosis, their family and friends need to be informed about the condition, with the knock-on effect of their disbelief, anger and upset. Now the gravity of the situation is really going to snowball. So let's now take a more in-depth look at these emotions. Shock and disbelief. It's understandable that shock and disbelief would be the primary emotion at this stage. The sufferer, unable to believe this was happening to them, or hoping they'd wake up and it would all be a dream. These emotions need to be empathised with. Module 1 is designed to let the sufferer vent those emotions, because once they are vented and understood, the sufferer is then free to emotionally move on with greater acceptance. Denial. Denial is a natural defence to information we don't want to accept. We all have the ability to do an impression of an ostrich in the desert and bury our heads in the sand. Or we turn that denial into blame and blame our predicament on other people's behaviour. Denial can be very dangerous for a cancer sufferer, because the longer they spend denying their condition, the less time and effort they may be putting into taking responsibility for their illness and their recovery. In some cases, denial is a benefit, as it psychologically stops the sufferer becoming overwhelmed. However, the downside of that is that they aren't participating in getting well. Some individuals do live in ignorant bliss, failing to deal with the issue they are ignoring. The answer to such denial is simple: go and see another doctor for a second opinion, because at least then everyone knows where they stand. Cancer sufferers in deep denial are protecting themselves from the reality of their condition, the ultimate ostrich syndrome. Unfortunately, with this kind of sufferer, by the time they do actually admit they are ill, their symptoms may have become so severe it's often too late to really do anything to help them. With all cancers, the earlier it's diagnosed and treated, the better the long-term prognosis is. Anger and grief. After the denial and shock has subsided, cancer sufferers often feel angry and full of grief. What started as a minor ailment or annoyance is now a potentially life-threatening disease. This disease now needs treatment. It needs recovering from. It's going to mean that an individual's lifestyle is potentially turned on its head. There's a major new priority that needs addressing, and this priority could affect every aspect of not only the sufferer's lives, but their loved ones' lives as well, especially if that carer is a family member or a friend. Not only that, but the sufferer and their family now have to deal with the cancer taboo. That perception from others that a cancer sufferer is somehow damned, contaminated. Friends and even family can withdraw away because they themselves are spooked or genuinely don't know how to respond to the sufferer. From the sufferer's point of view, just when they need support, their friends and family can appear to totally reject them. Obviously, with so many changes, the sufferer can suffer a form of grief, as the normal structure of their life and relationship appears to be turned upside down, because what they considered normal in their life is now gone. This new priority can affect a sufferer and their family on many different levels. Treatments need to be scheduled. Future plans may need shelving for the short or long term. Financial implications may need to be considered, as time is needed for recovery. The adjustment of the family unit and the way they individually deal with cancer can also have a significant impact. Fortunately, forewarned is forearmed, and knowledge is strength. The Cancer Survivors Toolkit isn't some fluffy holistic nonsense. It's an honest, insightful assessment of the predicament a cancer sufferer and their loved ones may find themselves in. It's extremely important to cut through the damaging emotional distress as quickly as possible, because it doesn't serve any productive purpose. However, it is a phase that needs to be completed before the sufferer can then reach a level of acceptance. Once acceptance is reached, they can then get focused on the journey ahead. Obviously, this can't be overstated. Fear is a perfectly natural response to the unknown. The Cancer Survivors Toolkit and the following modules are there to lessen that fear, to give cancer sufferers that all-important perspective. Fear is stress. Stress, as we already know, suppresses the immune system, which for any cancer sufferer is a waste of energy. We want full participation in recovery and not drowning in despair. Something else that's very important is that fear is linked to pain, and the more fearful someone is, the more intensely pain is perceived. By diminishing fear, this allows the sufferer to accept where they find themselves more readily and to build a more positive focus. Diminishing fear is an important element for anyone undergoing cancer treatment. Depression and isolation. Depression and isolation are perfectly normal, acceptable emotions when someone is diagnosed with cancer, because the gravity of their situation needs to be accepted and processed. It's fairly common knowledge that the male of the species generally withdraws and goes into his cave to evaluate things that are important to him when he's in a crisis. However, females generally like to talk and express their emotions more readily. However, females can also withdraw and become insular as they consider the impact their situation could have on the people around them. Once again, this behaviour is perfectly acceptable when faced with a major emotional trauma. Unfortunately, if the sufferer cannot reach a sense of acceptance or continues to deny their condition, the fact is their symptoms will still be there and growing as time goes on. Obviously, if the sufferer will not accept where they find themselves, they are hiding from the reality of the situation, and as their condition deteriorates, deep depression can arise as the gravity of their situation does eventually become apparent. Disappointment. At any point during a sufferer's treatment, they could unfortunately face disappointment, especially if they were doing well and then suffer a setback. This disappointment could then result in a return to any of the above emotional states. This is why it's vitally important the carer does not take responsibility for the sufferer's welfare. Because if they do, if setbacks appear, the sufferer could blame the carer, especially if they feel they have been given unrealistic expectations. The Cancer Survivors Toolkit is about making cancer sufferers responsible for their recovery by helping them to first accept and then deal with their predicament. It's important to remember that cancer sufferers are just people suffering with emotional and physical issues, and they need help to understand them and then process their feelings. The Cancer Survivors Toolkit is there to help them get the most from that treatment by lowering their stress and allowing them to focus on the effectiveness of their immune system, while also helping them build up their acceptance and emotional strength. Loved ones play a major role in influencing that mindset, but more on that later. I'm hoping by now, with what you've already read, you'll be feeling clearer about cancer and actually be starting to appreciate the positive benefits this program has to offer. The Cancer Survivors Toolkit is a complementary program. It's not an alternative. It isn't there to replace medical treatment. It's there to assist the sufferer in that treatment by relieving their stress and anxiety, using positive visualizations, and to allow the sufferer to focus on a positive outcome. Module 1. Offloading and Relaxing. When someone is diagnosed with cancer, any negative feelings or emotions they feel are of course justified and normal, but ultimately not helpful and don't support positivity. When someone is stressed and overwhelmed, they can become shrouded in a negative mindset. They can become obsessed and wrapped up in the wheres, whys and whats of their diagnosis and condition. For them to move on, they need to understand how these negative emotions are not productive or helpful, and to appreciate they could actually hamper their treatment and recovery. If you're suffering with cancer, you need to appreciate that where you find yourself is horrific. It may be very unfair, and it will be having a major impact on the people around you. But procrastination and beating yourself up is not the way forward. It's just a stage, and the sooner it's over, the better. Don't get me wrong, this is hardly an idyllic situation, and every cancer sufferer needs to accept that This is a case of making the best of a bad situation. If you are in a state of denial and disbelief, well, once again, this is a natural stage. If a few weeks before you felt healthy but had an annoying cough or a bit of bowel trouble, or you noticed a lump and went to get it checked out, the disbelief of discovering you had a form of cancer would understandably completely knock you for six. The more you consider how you felt before you went to the doctors and how you feel now, which in many cases physically won't be a lot worse, the more you could justifiably think that this was just a horrible nightmare, or that someone must have made a terrible mistake somewhere along the way. The fact is, early diagnosis and treatment of cancer gives by far the best results. So if you are a recently diagnosed sufferer and are in a deep denial stage, then be aware you need to either accept or reconfirm that diagnosis as soon as possible rather than deny it. It's vital you accept you've fallen into that crocodile pit and then start focusing on the steps you need to take to get out. If your denial is that strong, don't ignore it or play Russian roulette with your health. Getting a second opinion would be a sensible course of action and would confirm one way or the other which direction the future is going to take. Next, we move on to the practical side of Module 1 and an experiment I like to call Timeline. This exercise can be undertaken by both the carer and sufferer jointly or individually, and is a very helpful tool to be used whenever there is a choice to be made, or as a rehearsal where a positive outcome would be greatly appreciated. Timeline is very powerful, so take the time to learn it because you can use it again and again. Basically, Timeline gives the individual a rare opportunity to visualize the outcome of two different paths of behaviour over a fixed time period. So for example, a weight loss timeline gives the sufferer the opportunity to visualise how their life will be in 5 years' time if 1. They continue making excuses about their weight and eating unhealthily, or 2. They take control of their diet and stop eating on emotion. It shows them they have two paths, and also they have a choice as to how they want their future to be. So watch video 8, Timeline Experiment. As a cancer sufferer or loved one, you can now do the same. By using this technique, you can see what procrastination or denial might mean to you in a 3, 6 or 12-month period. And then by altering that path, see how much better your life will respond to a positive expectancy. Timeline is completely personal, with no two individuals experiencing the same thing. And the beauty of Timeline is that the visualization is generally very instant and very powerful. Without exception, you will discover very quickly the merits of the positive side of the timeline and see the uncertainty and misery of a negative, procrastinating mindset. It's important to remember that everyone has a choice between which path they wish to travel. It's all down to you. So take some time now, watch the video and learn the timeline. Once you've perfected it and run through a few different scenarios, then ask yourself to remember back to times in your life when you've been through really bad experiences. For example, when someone's died, a relationship breakup, family issues, career issues, health issues, financial issues, whatever it might be. Then close your eyes and really recall those difficult times and remember how you would have had to make tough choices and tough decisions. You should once again become aware of how much strength and commitment, how much determination you have deep down inside to overcome those negative events or resolve those traumatic issues. Consider that strength again, that drive, that commitment, and go back to the well once again. Muster that strength so you can have the positive side of the timeline rather than the negative side. We'll be referring to the positive side of your timeline a lot during the audio sessions that accompany this program. Study this technique and then adapt it and practice it as part of the Cancer Survivors Toolkit program. It's one of my favourite techniques as it's so powerful. The result of Module 1 is that you should feel far calmer and quieter, that a weight has been lifted, that you've let go of those damaging emotions and are more accepting of where you find yourself, and are looking to your options as you look to the future. Module 1 builds a foundation that leads us nicely on to assessing these new objectives with increased positivity and acceptance. So take your time with this module, as it's important you clear the decks for the following modules. Module 1B, Carer's Vent. As the saying goes, behind every great man there's a great woman. Similarly, behind every cancer sufferer is a primary carer or a group of carers. Module 1B is all about assisting, advising and raising awareness about how loved ones can best aid the cancer sufferer, whilst also protecting themselves from what could also be one of the most traumatic events they've ever experienced. Letting the carer vent. This module is very similar to Module 1A. However, the carer, although shocked and upset, will have other considerations depending on the relationship they have with the sufferer. If the carer is a spouse, we can expect them to feel dutifully bound to their partner. We can expect them also to feel scared, angry and compromised. Obviously, they won't want to share that side of their emotions with the sufferer. The fact is, very often, the carer has nowhere to vent their fears and concerns because they are too busy trying to hold the fort and maintain that stiff upper lip. The carer is there to assist and care. Their primary function is to aid the sufferer's recovery and to encourage a positive mental attitude, not to reinforce a host of secondary gains that keep the sufferer motivated to stay ill. We also need to consider that both the sufferer and carer's life may well have been turned upside down because of their condition. Let's not forget here, a cancer diagnosis doesn't just impact the sufferer. If the carer is the spouse, then consideration may have to be given to cutting work hours. This can have a knock-on effect on the household finances as well. The carer may now have to change roles completely. If it's the wife who is ill, the husband may now have to switch from primary carer to house husband. Situations like this can unfortunately build up resentment and negative feelings. The carer must be allowed to accept and appreciate the dark side of their thought process and accept it as a normal reaction to feel these emotions so they don't feel guilty. The fact is, psychologically, human beings can handle more or less anything. However, it doesn't mean we're going to like it, or that it's not going to cause us pain or hardship. But the fact is, one way or another, you can handle it. Often carers have to portray an image of being happy, relaxed and optimistic when they are in the sufferer's company, even though inside they are falling apart and just want to run away. They may also feel resentment that they have had to be the carer, especially if that carer is the child of an ageing, awkward parent. As a therapist, I've often heard the story in my consulting room about the son or daughter that have diligently cared for a sick, ageing, older parent that continually puts them down or takes them for granted. Curiously, their siblings who rarely visit or show any concern are praised and looked on approvingly by the parent. This child just wants approval and love, but instead gets treated with contempt and taken for granted. This type of carer definitely needs to let this stuff out. No two carers go through exactly the same experience. What we have here is just a general outline of what's to be expected. As you'll discover in the next section, the carer can have a major influence on the cancer sufferer's desire to get well. The next section is about understanding secondary gains and how the carer could be inadvertently stalling the sufferer's recovery by over-caring. Understanding secondary gains. As we've already discovered, a person's conditioning, their personality type, their age or their responses to long-term stresses and emotional trauma can reduce the effectiveness of their immune system. potentially allowing disease to manifest itself. As extreme as this may sound, sometimes cancer sufferers see a cancer diagnosis as an excuse to opt out, to get off the roller coaster that is their life. This behaviour could be called rather sarcastically the benefit or the gift of cancer. It allows the sufferer to offload their responsibilities to others around them. There may also be an element of "I told you so" in their psychology if the sufferer has a bit of a victim mentality. Well, if this kind of sufferer were then to receive lots of love and attention, with everyone running around after them, taking care of their every whim, well, after not too long, that individual could grow to rather enjoy the benefits of being ill. I remember my aunt who contracted lung cancer soon after being diagnosed, commenting in a jokey kind of a way, "It was great being ill. I don't have to lift a finger, everyone does everything for me." These benefits are called secondary gains. But why secondary? Well, having cancer obviously isn't a gain or a benefit, but all the fuss and attention that goes with it could be a secondary gain, a positive byproduct of being ill. Here's the problem though. A carer obviously wants to do the best they can to aid the sufferer, especially if they are family. The problem is, if those secondary gains are so great, the sufferer, depending on their personality type, may not want to give them up, especially if recovery means they have to head back into the stress situation they wish to leave behind in the first place. So it's important to make sure the carer understands this point. This doesn't mean the carer has to back off completely and reject the sufferer's condition. What it means is carers should be supportive, but encourage the sufferer to participate in their recovery, to actively stay in control, to focus on their treatments, and to stick 2 fingers up to their cancer. This is the best care a carer could possibly give, to motivate the sufferer into taking responsibility for their illness and their recovery. Both the carer and sufferer will feel more a part of the process if they are actively taking part in it together, rather than fueling the neurotic, needy side of the sufferer's condition. This is the approach we need to push. Some carers will find this extremely difficult because they'll want to wrap the sufferer up in cotton wool, to make the coming months and years as special and as caring as they can. In this instant, the carer is actually placing their needs above the needs of the sufferer, and this obviously needs to be addressed. Caring for the carer. The carer has to appreciate that where they find themselves is not where they want to be. But like it or lump it, they have to deal with it. They are in that crock pit as well, unfortunately. That said, they also need to appreciate the most important person in their life at that time is themselves. That may sound a little selfish, but please bear with me. The fact is, if the carer is not healthy, optimistic, and the best they can be, how on earth can they expect to then project that onto the sufferer? If they don't take care of their own needs, all that's likely to happen is that they will run themselves into the ground, becoming tired, depressed, and resentful. It's vitally important the carer understands this and makes time for themselves. A martyr is no good to anyone in this situation. The carer needs to spend time away from their caring role on a regular basis, nipping out for an hour for a coffee on their own, watching a film, going for a walk, an evening out visiting friends or relaxing by the radio, or even relaxing by listening to the audio download for this module. Whatever it is that gives them that distraction and chance to recharge their emotional batteries. If this doesn't happen, the carer risks burning out, and that's no good for them and certainly no good for their charge. Carers are there to support and encourage, not to run themselves ragged. That's not productive and it's not good care. Carers also need to find a safe place to relieve their negative emotions and have a safe place to drop their protective guard. Sometimes just having a good cry away from prying eyes can make a massive difference to how the carer feels. Every carer has to realise they are not only caring for the sufferer, but also caring for the carer as well. As we already know, carers can experience similar emotions to sufferers. Relaxation and inner guru, which we'll discuss shortly, will be a welcome distraction for both. On a practical level, timeline can be extremely beneficial to the carer as well. But for them, this will involve them seeing the results of a positive, healthy, caring environment for themselves and the sufferer, rather than one full of secondary gains, with the carer tired, resentful, and generally feeling ground down. We want carers to draw on the strength and commitment analogy we used after the timeline for sufferers, and adapt it for themselves. The relaxation audio for Module 1 can then be enjoyed by the carer as well, on their own or even jointly with the sufferer, leaving both feeling calm and relaxed together, reinforcing that bond if you are a husband and wife. Module 2, Taking Control. This module is all about moving forward and motivating the sufferer to reach their objectives. The first step in this process is the sufferer has to take responsibility for their treatment, to realise they are in charge, not the cancer. We need to encourage every cancer sufferer to build up their resistance, their defiance, and to mentally fight this thing, rather than just handing themselves over to modern medicine and blindly hoping for the best, which is unfortunately what our culture has encouraged us to do, a physical problem fixed with a physical treatment. As a cancer sufferer, you need to be active in this fight, to mobilise your immune system by relaxing and reducing stress, so your immune system starts to recover, so those NK cells, those piranhas, multiply and fight. As we said, the Cancer Survivors Toolkit offers a three-pronged attack. So we need to include not only medicine and positivity, but also a healthy, active lifestyle, which we'll discuss a little later. So now watch video 9, Hypnosis, Healing and Recovery. Instilling positivity. Something that's very important when gaining the upper hand in this psychological battle is that the sufferer doesn't view themselves as a victim to cancer. Instead, they view themselves as the dominant force, the boss. Because as we said earlier, cancer is just a collection of weak, unruly, disorganised cells. An analogy that seems very fitting in this day and age is to view cancer cells as terrorists. Terrorists that are trying to invade the host, to get a hold, to start trouble. It's up to every individual sufferer how much respect they are prepared to give those terrorists, and to remember that unlike our voracious immune system, these terrorists aren't a trained, organised military unit. They're unruly, they're militant cells. They are disorganised and weak, and ultimately they need to be quashed. Terrorists may have had their profiles heightened with recent atrocities, and have caused major disruptions, but ultimately those terrorists were quashed by a healthy, motivated, organised military force. We need to view cancer in much the same way. As we already know, stress causes the immune system to become distracted, allowing illness to manifest itself. So visualisation of the mobilisation of our immune system is vital. Not only that, but the sufferer is then actively taking part in their recovery. They are participating in getting well. Of course, loved ones can play along with this scenario and encourage their charge to use this visualisation regularly, because this will help strengthen that mindset. Unfortunately, in the Western world, medicine is viewed as all we need to remain healthy and to overcome illness. As such, generally we just surrender ourselves to medicine and hope our ailments will be cured. We give ourselves to the medics and then wait for our symptoms to disappear. If they don't disappear, we'll try another medicine or medical treatment until hopefully they do. In the East, they view healing as a three-way fix. They do use medicine, but also the mind and lifestyle. We've all seen or heard of operations being conducted without anaesthetic, the patient just using their willpower or meditation or self-hypnosis to distract themselves. Look at the effect of a placebo. We believe it's a medicine, it relieves symptoms, and if that placebo is given in the form of an injection rather than a tablet, the positive results increase significantly. The mind then is very powerful when it's focused on healing. We'll talk more about the power of placebo in the next module. I want you to accept that a positive, defiant mindset plays a massive part in our belief and motivation to recover. Without that belief, we aren't fighting as well as we could be. In fact, we could be viewed as passive, hoping that others will rescue us. They will restore us to full health. Hopefully the doctors will magically cure us, or maybe the good Lord up in heaven will come down to our rescue. How defiant is an individual actually going to be in that situation? The positivity and hope they themselves should be using to recover, to support their immune system, is actually being given away to others. Remember, our immune system, when we're healthy, does battle with cancer cells on a daily basis and wins. That's a very important point to remember. The Cancer Survivors Toolkit is here to get cancer sufferers motivated to fight by giving them the will to fight and that motivation. This means building a mindset that is focused on health and survival, not on being ill and dying. The curious thing is, we all accept that a negative mindset, a moany, broody mindset, is more likely to encourage ill health and negative outcomes. However, the thought that positivity will improve health or reduce illness seems a much harder concept to grasp. I love using analogies as a way of expressing scenarios, and I find the more I use them, the better my clients grasp the concept. So when I'm in session, I like to run through as many analogies as I can to bring scenarios and theories to life. So now let's do a little experiment to demonstrate the power of positivity with regard to pain. So I want you to pinch the skin on the back of your hand. Pinch it quite tight. Then for 1 second focus on the pinch and tell yourself how much it hurts, how painful it is. Then for another second say to yourself, I can't feel a thing, this doesn't hurt at all, and just notice the difference in the sensation you feel. Did you notice the change in sensation just because you altered your thought pattern? This is a good demonstration of the power of positivity in relation to our bodies. Positive thoughts mean less discomfort and give you more control. Remember, we're looking to build positivity here by building associations that can easily be bought into. The fact is, the quicker the sufferer realises the level of control they have, the better they'll fare long term. In fact, if our sufferer can grow to view their cancer with contempt, to view it as an annoyance they're not prepared to tolerate, how much more motivated are they going to feel about building that all-encompassing positive kick-ass mindset? How much more empowered is a cancer survivor going to feel as they go for their chemotherapy if they are psychologically buying into their treatment? They'll be working with it and see it as a powerful ally rather than something negative. Sufferers need to view their cancer as something they have, but that doesn't have them. By doing that, they'll help erase the taboo nature of cancer from their psychology. Something else that's very important is that sufferers don't hold on to the emotional distress they feel. The majority of cancer sufferers will want to protect certain friends and family by not making a big deal out of their illness. So it's important to find people they can talk to offload and to get reassurance from. It's important sufferers don't feel intimidated by their condition or by the medical profession. So ask the questions you need answers to. Obviously, the more positive and optimistic the sufferer is, the more the medical profession will open up to them. The point is, the more you talk about your feelings, the less stress you'll feel. Something else that's very important is to realise you are not alone on this journey. You are part of a team. In fact, you are the head of your team. Your team includes your carers, doctors, consultants, maybe even this program, and of course the friends and family you can rely upon. So there's a lot of people there. But is that enough? Well, how about if we could give every sufferer a psychological mentor, an advisor, a guide, a guru, a friend that could be there for them as and when they need them. Someone they could confide in, that could comfort them and assist them honestly and openly on their journey, much in the same way a loving parent comforts and guides a young child. A spiritual mentor, an inner guru. Imagine that, having a friend, someone you could ask questions of, someone you could talk to in the middle of the night, a respected authority figure, a friend you could call on secretly to answer questions, to advise you, to listen to your fears without judgment. Your inner guru is of course part of you. Or should I say a part of your subconscious, your inner friend. For the majority of us, we give up our imaginary friends when we leave childhood and become distracted by the noise of our adult lives. However, using the relaxation audio, you can introduce yourself to your inner guru. And this inner guru can take any form you wish. A favourite teacher, or a family member you respect, a parent, a trusted friend, a celebrity, a film star, even a cartoon character from one of those old Walt Disney films. In fact, anyone or anything you find appealing. But obviously someone you can trust and has your best interest at heart. That wise old sage who will listen to you and then roll out a couple of pearls of wisdom that calm and encourage you. As a point of note, this isn't about being religious and relying on a god. This is much more personal. Although if a religious figure appears and you have faith in their judgment, that's perfectly acceptable. The important thing is that the sufferer knows their inner guru is always there for them, and separate from the day-to-day concerns and noise of their daily life. Their very own personal genie in a bottle. So how do sufferers benefit from an inner guru? We all know the old adage about how easy it is to sort everyone else's problems out, but so much more difficult when those problems are your own. Well, the reason is because if we're not emotionally involved in something, we can see things in a truer perspective. We can make a clearer judgment based on the facts. Your inner guru is that impartial judge, not one clouded by emotions. Some individuals may experience difficulty initially first meeting their inner guru, but like most things, perseverance is the key. Despite everything I've said about being sympathetic and empathetic to cancer sufferers, this module is the module where we do want to kick ass. So that's the first part of this module, building a positive mindset, taking control, and understanding the importance of participating in recovery. So next, what other ingredients could we introduce to help sufferers? Well, how about an improved lifestyle? So let's get back to basics here. We all know to be healthy, we should do some regular exercise, eat healthily, and get lots of rest. We all know that, but how many of us actually do it? How many of us actually make it an ongoing lifestyle choice? Generally, we just go about our business day to day until we feel we have to go on a diet or join the gym because of an up-and-coming event, or we realise we've let things slip a little too far. The fact is, for most of us, we don't make sustained changes in our lifestyle until we really feel we have to. The stupid thing is that right from being little tots at school, we all learned that to be healthy and fit, we needed to exercise, we needed to eat healthily, and get plenty of rest. Do you think anything has really changed? So let's now apply this common sense to cancer and ask a simple question. Which do you feel would best complement a positive kick-ass mindset and body. A sedentary, depressed lifestyle with a poor quality diet, or a healthy, active lifestyle that gives the body the best possible opportunity to promote health and well-being? Well, of course, it's answer number 2. Appreciating and understanding this gives the cancer sufferer yet another powerful tool that not only aids their body, but also their mindset and their medical treatment. If you were going into battle, you want to be as fit and healthy as you could be, no matter what your age or circumstances. In fact, any improvement in this area has to be of benefit, doesn't it? So now watch video 10, Anti-Cancer, A New Way of Life. I don't want to turn this part of the module into a lengthy lesson on nutrition and lifestyle. All we need are some simple guidelines that are easy to implement and understand. However, for people that do want more info, when you purchase the Cancer Survivors Toolkit, you'll also receive the Cancer Survivors Toolkit Lifestyle Guide. Watch video 11, Diet and Exercise. I think the best analogy we can use to understand the effect nutrition and exercise has on our bodies is to imagine that our veins and arteries are like pipes. These pipes are our body's highways, allowing those Pac-Men, those piranhas, to cruise around unhindered. And that if we don't exercise and fuel our bodies correctly, those highways become polluted. They become stagnant, and because our internal environment becomes contaminated, our immune system finds it harder to distinguish and locate those harmful bacteria and cancer cells. Another analogy might be to imagine our bodies as a meadow, a healthy, lush meadow full of vegetation and animals. If someone dumped a small amount of toxic waste into that meadow and then kept adding to it on a regular basis, what would happen to the vegetation and animals as time went on? Well, they'd get sick and die. We can liken this example to a cancer that's been formed through poor lifestyle. So if we were then given the task of restoring that meadow back to good health and then maintaining that natural environment, what steps would we take? Well, initially we'd look to remove the pollution directly, medical treatment. Then we'd look to maintain that clean environment by not adding any more toxins, healthier lifestyle. By doing that, we'd obviously be encouraging health and well-being. Next, let's talk about stodgy food. What effect does that have on our bodies? What analogy could we use here? Well, how about we visualised our blood becoming thicker, heavier, more like syrup? Well, that would make it extremely difficult for our immune system to immobilise itself as quickly as it needed to protect us from those harmful terrorists. The fact is, being overweight increases your risk of cancer by between 40 to 60%. Not only that, but if we don't get enough exercise, our heart, the pump that runs this system, isn't going to function as effectively as it should. The result? The whole system slows down. This then impacts on our body's filtration system, the liver, kidneys, and the lymphatic system, resulting in our bodies really struggling to maintain a clean, healthy environment. The good news is, however, that with only a few simple common sense changes, diet can very quickly be improved. Likewise with exercise. I want you to appreciate how important it is to create an environment that's conducive to a healthy, motivated immune system. We want our body's NK cells, those piranhas and Pac-Men, all at full strength, alert and hungry. It's vitally important to listen to any specific dietary advice you're given by the medical professional first and foremost, as this will vary depending on your specific treatment. However, the general rule of thumb is that cancer sufferers should stay away from foods that contain an excess of sugar and salt, along with red meat and dairy products. And here's the reason why. Salt reduces oxygen in the blood and is very corrosive and acidic. Sugar is converted into glucose inside the body, and glucose feeds cancer cells. Dairy. Due to modern livestock feeds, intensively farmed dairy products can contain an excessive amount of omega-6, which encourages the growth of cancer cells. Red meats. As with dairy, the meat from intensively farmed animals contains excessive amounts of omega-6, which can encourage the growth of cancer cells and tumours. For more detailed information on the above, please refer to the Cancer Survivors Toolkit Lifestyle Guide. When it comes to exercise, I don't want to frighten you or add to your stress by telling you need to start running marathons. I just want to point out the simple facts. A healthier body will fight disease better and recover faster than one that's unhealthy. So, if you could consider doing 30 minutes light exercise 3 times a week as a starter, that would be sufficient, even if that's just a gentle stroll. Then increase it if you wish. Once again, those 30 minutes worth of activity will aid both your body and your mind. One further point about positivity is, it's unrealistic to expect any individual to feel positive all the time. Everyone, no matter what their situation, has bad days when they feel cheesed off or blue. Sometimes we just wake up feeling blue, so it's okay to have off days. And if that's what you're experiencing, just accept that fact and roll with it. Tomorrow is another day. Before listening to audio 2, I'd like you to consider your own personal view of your cancer, because how you view it gives a good indication of how you really feel about it psychologically. Do you view your cancer as something that is strong and powerful, or something that can be overcome? If it's the former, now is the time to start working on adapting that visualization, so you view your cancer with defiance and as something that will be overcome and defeated. To conclude this module, I'd like you to do another simple timeline experiment. However, this time, I want you to view one side of the timeline as you being submissive to your cancer and not really participating positively, and see how it plays out. Then on the other side, to visualize yourself as positive and defiant, having made those all-important positive mindset and lifestyle changes, and see how much more comforting that feels. This module is the real nuts and bolts of starting down the positive side of your own timeline. So take your time, build acceptance, and make sure you buy into this, because then you'll be happier, you'll cope better, and recover more quickly from your medical treatments, and you'll look to the future with much greater optimism. At the end of this module, I want you to feel empowered and clear in your mind about what you're trying to achieve. You can do the timeline and listen to the audios as many times as you wish. To assist you with this module, please go to the treatment area on the website, so you can download the Motivation MP3 audio, plus the Lifestyle PDF, and access the appropriate videos. Module 3. Positive Treatment, Fear and Pain Relief. This module is all about preparing for treatment, removing anticipatory anxiety, and helping relieve the psychological symptoms associated with pain. The fact is that many forms of cancer aren't actually pain-causing. However, the majority of sufferers believe they will suffer significant discomfort. Almost every pain symptom associated with cancer can be significantly reduced or eradicated with medication. So to a large extent, cancer patients shouldn't have to physically suffer unduly. This doesn't mean that things will always be plain sailing, because some cancer treatments are invasive and do take their toll both physically and emotionally. However, if the sufferer's mindset is focused on getting well, and they view the treatment and possible side effects as just part of the process, they won't be building up heaps of anticipatory anxiety and focusing on the negative elements of the treatment. Anticipatory anxiety is when an individual focuses on the negative side of events, making themselves overly scared by rehearsing negativity to the point that it's all they can focus on. No cancer sufferer chooses to be ill, but now they need to make the best of a bad situation. This program's objective is to assist cancer sufferers and their loved ones by breaking down damaging negative belief systems, because negativity and fear can have a massive effect on an individual's perception of pain. We also need to know if there are any secondary gains associated with the pain. As we already know, secondary gains can be a strong motivator, especially if the sufferer is handsomely rewarded with attention and affection, or it allows them to opt out of their day-to-day life. Therefore, very simply, is pain or perceived pain being accentuated by secondary gains? As the sufferer, ask yourself these questions. Does this pain actually serve any purpose? What do I need it for? What am I getting out of it? Is my pain productive? What are the rewards for having pain? This next statement may sound a little inconsiderate, but without the physical expression of pain, cancer is just an ailment. The expression of pain, real or otherwise, validates the seriousness of the illness, especially where secondary gains are concerned. Another factor that's vitally important is the effect fear and anxiety can have on our perception of pain. Fear makes us focus on pain and can actually make our ailments seem much more intense than they really are. As we all know, in the wee small hours of the morning, even a minor ailment can seem a lot more intense. Fear can build up negative expectations. We expect to suffer more, and because we are focused on a negative outcome, we are subconsciously fueling that anticipatory anxiety. Mind acting on body, body acting on mind. So if fear and anxiety build a negative expectancy, it stands to reason that positivity and relaxation will encourage resistance to pain and suffering. Remember, we're not talking about real pain, we are talking about perceived pain. We already know that deep relaxation, hypnosis, and a positive mindset can achieve outstanding results in the field of healing and complementary alternative therapies. Just consider again the little experiment we did in the last module, where we pinched the skin on the back of our hand. So now watch video 12, Hypnosis for Pain Relief. Sufferers that have already been through module 2 will be far more accepting of their current position, and will also be keen to add to their knowledge and positivity. So let's now start looking at what we can offer to assist medical cancer treatment. As we already know, there are 3 main medical treatments for cancer: surgery, chemotherapy, and radiotherapy. Each has different considerations as a treatment, as we'll discuss shortly. Ultimately, Module 3's aim is to allow the sufferer to view their treatment as a positive experience, with any potential side effects being viewed as just par for the course, or as a necessary evil that will rid them of their cancer. If you feel positive and optimistic, the fact is you'll deal with your treatment and recovery so much better. So let's now look at how we can add that positive visualization to each of the 3 cancer treatments. Surgery is the most common and rudimentary of hospital procedures, involving a localized invasive procedure, and is highly successful as a medical treatment. We all appreciate and accept that after an operation, our bodies need time to recover, and that recovery will involve a measure of pain and discomfort. With an operation, obviously having a positive upbeat nature is extremely beneficial. So as a sufferer, we need to get you to view your surgery as a fast, effective, systematic removal of your cancer, using the most up-to-date medical knowledge along with the most advanced surgical equipment medicine has to offer. The audio for your surgery will assist this treatment and your recovery by using deep relaxation and your own powers of visualization, so you can see your body healing itself, the tissues repairing themselves, those new healthy cells growing to replace the void left by the removal of those weak, disorganized cancer cells. Your healthy, active white blood cells cruising around, policing your body's highways, keenly looking out for rogue cells and instantly destroying them. Radiotherapy. Radiotherapy, as we already know, is used in conjunction with smaller, more localized cancers. This treatment in its simplest form consists of X-rays or laser beams being fired into the affected area, usually from multiple points. From a visualization point of view, laser beams are an easily imagined destructive force. Once again, it's important to remember these laser beams are aimed at those weak cancer cells, and that as the days and weeks of the radiotherapy continues, those laser beams will be precisely blasting away, each time reducing the size of any cancerous growths. As with chemotherapy, there may also be some minor collateral cell damage, but any damage to the sufferer's healthy cells will quickly recover, whereas the cancer cells won't. Of all the cancer treatments, chemotherapy is the one that causes the most fear and concern. The side effects are well reported. However, what's not so well reported is that sufferers with a positive mental attitude, who are more accepting of their treatment, actually suffer far less side effects than those who worry. Question: if you are scared of chemotherapy, will your body be more accepting or more resistant to that treatment? Okay, what about if you are now ready to accept that same treatment, but this time to also accept that there may be some associated side effects? Remember, if a positive mindset encourages recovery, obviously a negative mindset will hinder it. It's important that anybody going through chemotherapy accepts their treatment and views it as their get out of jail free card. So if you are happy to welcome those powerful medicines into your body unhindered, and then to allow them to penetrate every nook and cranny, you'll be psychologically maximising the effect of the treatment, won't you? You'll be happy to let those powerful medicines find and destroy those weak, disorganised cancer cells with a positive and open mind. Psychologically, you'll be buying into the whole process with the added benefit that you'll feel more relaxed and accepting. Once again, any side effects need to be viewed by the sufferer as them making the best of a bad situation. The important thing is to remember here that because the treatment is so strong, it does cause collateral damage. However, we want anyone going through this treatment to realise any discomfort is the result of those healthy cells restoring and repairing themselves as the cancer cells wither and die. In any battle, in any fight, the victors have to sometimes take a few hits before they can overcome and then win the war. We've also all heard the saying, no pain, no gain. Well, that's exactly the attitude cancer sufferers need to adopt. As such, they'll feel far less likely to fear the side effects of their treatment. They'll appreciate that side effects are to be expected, but hey-ho, that's the nature of their illness. Please appreciate we're not playing games here. You're in a battle, and you need all the tools, motivation, and assistance you can muster. The fact is, any pain or side effects will diminish, and that a positive mindset focused on health and well-being, combined with painkillers if required, will all help in both the speed of your recovery and the effectiveness of your medical treatment. To emphasise the power of the mind and its effect on pain relief and mindset, let's take a look at placebo and how it works. A placebo, as we know, is a fake medicine, a fake pill, a fake injection, a fake treatment that contains no medicinal healing elements whatsoever. All a placebo contains is a perception by the patient that the treatment will, in whatever form it's administered, relieve or cure their condition. A perception that they are receiving a fix. However, all a placebo does is psychologically encourage a positive expectancy in the patient. that in many cases actually cures them. The wonderful thing about placebos is they really do produce some amazing results. The more the individual buys into the placebo effect, the greater the results. So increased dosages, or the means by which a placebo is administered, all appear to have a profound effect on its effectiveness. But why? Well, if it's not physically aiding the sufferer, it certainly is psychologically. Which brings us back to the mind-body connection. The individual believes the placebo will give them a positive outcome, and amazingly, in a large amount of cases, it genuinely does. The placebo phenomenon is simply mind over matter. The subject is healing themselves with positivity. They are lowering their stress levels because they believe the placebo will fix them. Ultimately, they're relieving their symptoms, reducing side effects, relieving their own pain and suffering with their own psychology. So now watch video 13, Placebo Effect. So how can we assist someone with cancer to increase their positivity? What new tools and analogies would be beneficial to them? Pain relief through visualization. You should by now be feeling far more aware of the benefits of positive visualization and relaxation. So when it comes to visualizing pain relief, you should already be aware how powerful your mind can be. Here are a few scenarios we can use to help increase that awareness. 1. And this method follows on from Module 2. Instead of the sufferer viewing their immune system mobilizing to fight cancer cells, this pain relief version involves the sufferer seeing their body releasing its very own natural pain relief hormones and endorphins, and then imagining those hormones flowing into the areas of discomfort, massaging that area, and then relieving the pain. Also visualizing increased blood flow to the affected areas that then warms and comforts the pain will add additional reinforcement. 2. How about if they could view those natural pain relief hormones as a surge of beautiful, pure, bright, white crystals that surround the area of discomfort and magically relieve the pain, followed up by those bright white crystals of healing goodness, now destroying any undesirable cancer cells as well. Like all positive visualization, it's very individual, and the results will improve with practice. 3. As a therapist, a large part of my client base suffers with anxiety in one form or another, whether that's due to cancer, childhood trauma, relationship breakups, whatever it might be. Often when clients are deeply relaxed and using visualization, they may experience their anxiety as an object they feel inside their body, so it may have a specific shape. It may live in a certain place, generally in the chest. If pushed, they'll admit their anxiety object has a colour and a texture, even a material consistency. Well, pain can be viewed in a similar way, as a physical object. In this instance, if sufferers can visualize their pain as an object, they can then work on diminishing its effect. This can be achieved in a number of ways, by either imagining their pain object reducing in size, getting smaller and smaller until it disappears, or if it has a strong colour, to see the colour washing out of it, or to visualize it fading away, or as ice melting away as warm blood surrounds it. In each scenario, as a visualized object diminishes away, so should the perceived pain. 4. Call on your inner guru to assist you by going to the area of discomfort and soothing or massaging that area until the pain subsides or reduces. 5. Rather than focusing on the pain and letting it get you down, practice finding a distraction. So go out, phone a positive friend, watch a comedy show, do something to break that negative focus. So now watch video 16. Please feel free to go over this module as many times as you feel you need to before doing the exercises. As in the previous 2 modules, there is another timeline you can use to show the effectiveness of positivity in regard to your medical treatment, with one side of the timeline showing you how your medical treatment might progress if you are fearful and negative, and the other side showing you the same scenario, but this time now utilising the power of positivity. Module 3 can be used as often as treatment is required, each time viewing the cancer as that invader, as terrorist, as a nuisance to be blasted with laser beams, or seeing chemotherapy as that cleansing white light. Obviously, you can mix and match these visualizations to your individual needs. The desired result following Module 3 is that the sufferer sees themselves as optimistic, positive, and having an active part in their recovery. You didn't choose to be in this situation. However, now you are, you better make the most of it. The download area for this module can be found on the website as usual. Here, you and your loved ones, your carers, can reinforce what you've learned in this module by viewing a selection of carefully picked videos and downloading the appropriate audio files for your specific medical treatment, surgery, radiotherapy or chemotherapy, and the other for pain relief. And now Module 4, Reinforcement and Surveillance. This module is for sufferers who have undergone their medical treatment and have received positive results in the form of remission or an all clear. Obviously, any sufferer will be delighted, but also very keen to either continue their recovery or maintain that all clear. As a recovering cancer sufferer, you should now have totally bought into the concept of participating in your recovery and will be extremely enthusiastic to maintain that positivity. So this module has 2 goals. 1. To congratulate the sufferer. The fact is they've been through a hell of a lot and they need to reward themselves for the way they've behaved. Not only that, they will obviously wish to psychologically offload and come back down to ground. And 2. To reinforce that positivity by continuing the good practices they've already developed, by using positive visualization to continue boosting their immune system and maintaining those positive lifestyle changes, and then enhancing that positivity by setting enjoyable goals for the future. What we are encouraging here is continued participation in health. The truth is, once the crisis has been averted, it can be all too easy to relax and revert back to those potentially destructive old habits and routines. The fact is, cancer or any other serious autoimmune disease can be viewed as the body rejecting the lifestyle, especially if that lifestyle is physically or emotionally stressful. It's important that they don't become complacent and revert back to the stress situation that initially led them to developing cancer in the first place. Every cancer sufferer naturally fears a reoccurrence on some level, so it's vitally important the recovering cancer sufferer is aware of the long-term stress or lifestyle triggers in their life. Otherwise, they potentially risk walking straight back into those same destructive brick walls. Ironically, for many people, recovery from cancer can be a trigger, a catalyst to making major changes in their lives. Often when sufferers have come through such a traumatic ordeal, they feel they've been given a second chance to do things properly, to do more of what they feel is going to make them happy, rather than what's perceived as being the correct thing for them to do. So have a good think about that yourself. Goals and targets. Obviously, setting goals and having targets is important for all of us. Having something to aspire to gives our lives meaning. So encourage this in yourself. The fact is that most people think if they were told they had cancer, they'd start doing all the things they'd put off and go out with a bang. Unfortunately, the opposite appears to be true. People generally withdraw from life. In reality, individuals who defy death or serious illness generally have stronger goals and reasons to live. In other words, they have distractions and motivations that keep them away from that negative expectancy. If ignoring your emotional needs raises stresses and stunts your immune system, enhancing your emotional needs must surely have the opposite effect. So encouraging the setting of new goals and desires will obviously have a significant impact on the quality of a cancer sufferer's life. This isn't about doing stuff for the sake of it. This is about doing things that build emotional happiness, and certainly not doing what they feel they have to do to be responsible or dutiful to others. That's how the rot starts in the first place. It's a simple case of moving away from being a pleaser and putting your emotional needs and wants higher up your priority list. This type of goal setting mustn't be viewed as selfish or irresponsible, because setting a few achievable goals creates motivation to live, and once achieved, positively rewards the soul. In many cases, a cancer sufferer's goals and desires will be the exact opposite of how they actually live their lives. It's vital that these goals reinforce the cancer sufferer's will to recover and aid that motivation to mend. Example of simple goals might be: a workaholic makes time for relaxing hobbies, fishing, sailing. The mum or family carer travels and socialises, learns to move themselves higher up their priority list and to do more of the things they actually want to do. It's important for them to appreciate that they are the most important person in their lives, because if they are not fit and healthy, how can they possibly look after the people they really care about as well as they can? They need to be the best they can to help the people they truly love. This statement generally raises a few tears in my experience from pleasers. Other areas may include taking time off, booking that holiday you always promised yourself, doing that parachute jump, sitting down and working out your bucket list, or simply just finding a quiet spot and asking yourself, what do I want to do today that's going to make me happy? Goals should be both achievable and inspirational. So ask simple questions. What could I do that would make my life better today? Remember, we are just pressing buttons, but the buttons we are pressing are there to help recovering cancer sufferers change their perception of their needs. Obviously, some goals will require a large degree of planning and preparation. So a large goal may have stages, each stage being a hurdle that in itself is another goal. Relaxation and visualization are a vital ingredient when goal setting and an important part of maintaining a healthy life balance. Once again, a timeline experiment would be beneficial. This time, the negative side showing the sufferer relaxing back into destructive old patterns and feeling compromised. The positive side allowing them to see the long-term effects of continuing with their new healthy lifestyle choices, setting goals and regularly partaking in their surveillance visualizations. In the audio for this module, I want you to reward yourself by giving yourself a good old pat on the back. I also want you to start using relaxation and visualization for the purposes of surveillance. How does this work? Well, you'll now be very familiar with visualization, the highways and byways of your body's immune system. The surveillance side of Module 4 is about visualizing those weak, disorganized cancer cells totally eradicated for an all clear, or significantly reduced in the case of remission. In either case, those natural killer cells still need to be alert, healthy and hard-working. So I want you to visualize your body's immune system restored to full strength, with those powerful white blood cells eagerly patrolling and policing, instantly ready to pounce on and destroy anything that looks even mildly suspicious. Module 4 is all about rewards and maintaining the positive improvements the sufferer has made. The videos on this page are duplicated from Module 2, but are used in this instance as a reminder. Module 5, Dealing with Setbacks. Unfortunately, in life we all suffer from setbacks. It's how we perceive and deal with these setbacks that determines how much impact we let them have on our lives. This is especially true with illness. Following cancer treatment, sufferers either recover or the cancer continues. If the cancer continues, then more treatment is generally required. From a psychological point of view, anyone that's recovered from cancer has already played out the many scenarios their illness could bring. So setbacks for many have already been considered. The important thing with a setback is to maintain some perspective and actually appraise the situation calmly and coldly after the initial disappointment has dissipated. Otherwise, things can get blown massively out of proportion. From a personal point of view, I now have an aunt in her mid-70s who lives in Mississippi, USA. She suffered serious cancer 3 times in her life, starting in her early 30s. Fortunately, she's a very positive lady. Each time she's had a new diagnosis, she remains upbeat and has taken her treatment bravely and recovered well. My uncle is very supportive of her, and each time she suffered, he's nonchalantly said, "Okay, it's time to open another can of whoop-ass." That's why it's essential we maintain positivity and surveillance as well as a healthy lifestyle as much as we can. The unfortunate fact is that after cancer treatment, some sufferers will suffer setbacks. At this point on their journey, both the sufferer and their loved ones now know what to expect from continued treatment. However, this doesn't change the fact that the psychological reality of setbacks can be almost as traumatic as the original diagnosis. From the Cancer Survivors Toolkit's point of view, to gain some perspective, we want to ask some questions, because it's vital to ascertain what's been going on since the medical treatment. So it's important to ask yourself questions like, how significant is this setback? Is this just a blip? Has anything major changed in the sufferer's life? Have they experienced more emotional trauma, more stress in their immune system? Has the sufferer become distracted from participating in living and settled back into old bad habits? Has the sufferer become overwhelmed and given up? If the setback is a mild reoccurrence, it may just be a case of going back to the well one more time. Once again, going back to Module 2 and getting refocused will be a good start. Obviously, the severity of any setback will have a major effect on what treatment the sufferer's medical team will recommend. But once again, trying to maintain a true perspective is vitally important in order to keep these emotions in check. If the sufferer has been recovering well before the setback, then they seem to have all of a sudden slipped backwards. We need to establish if this reoccurrence is actually just a blip, because overall the client is actually beating their condition. It's so important to be positive and to maintain that emotional strength. Just look at Lance Armstrong. Okay, so he's really in the doghouse about his cycling antics. However, this guy beat cancer again and again. He had his team, but more importantly, he was full of motivation and defiance. We already know stress suppresses the immune system, and in extreme cases, the immune system becomes so suppressed it allows cancer and other autoimmune diseases to get a hold. So if a setback has occurred, is it because the sufferer has unknowingly put themselves back into a chronic stress situation? In which case they may psychologically still be looking for a way out again, mind acting on body, body acting on mind. Has the sufferer continued with the lifestyle changes they developed, which encouraged that positive expectancy and that motivation to mend? It may be they're so delighted with their progress, they've reverted back to poor lifestyle choices. If this is the case, then this situation is easily remedied. Understandably, any setbacks or reoccurrence are a time for reflection, a time to reassess the sufferer's motives and ongoing commitment to themselves and their lives. It may be time to consider any unresolved inner conflicts or beliefs the clients hold that may be jeopardizing their recovery. If this is the case, and the sufferer may be lacking in self-belief or has other self-esteem issues, now could be the time to consider expert psychological help to resolve them. Because until they are resolved, the sufferer may well just keep running back into the same chronic stress situation. If the sufferer wants to fight, that will be obvious. They may be frustrated, angry, or overwhelmed because they felt so much better. Once again, support and a good ear from the carers, from loved ones, from friends and family are essential to allow the sufferer to vent, and to allow them to accept how they are feeling is totally normal and acceptable. They should allow themselves a couple of weeks to let their emotions calm down and then get refocused. If they are struggling, maybe outside help would be beneficial. Another unfortunate fact is depending on the severity of the setback, the sufferer's age, or the stark reality of their situation, sometimes sufferers do just want to give up. They've just had enough. They're coming to the end of the line. Other times, the desire to fight becomes too much. It is not our job to try and motivate them to fight if they don't want to, nor is it our job to put them on a guilt trip. This is where a good chat, some awareness and acceptance will be the carer's best friend. Because setbacks are very individual in their seriousness and their medical assessment, there is no specific treatment for Module 5. This module is more about gaining a true perspective and not letting emotions get the better of us. So you have the choice of what tools you think will be most beneficial to you. So revisit the previous modules, watch the videos again, read the text, but above all try to remain positive. The Cancer Survivors Toolkit, as you will now be aware, is all about promoting positivity and optimism, so sufferers and their loved ones can find the strength and commitment to confront their cancer. The good news is that the majority of people who receive a cancer diagnosis will overcome their illness and recover, and this figure is increasing all the time. So if you've had a setback, but it's nothing too overwhelming, go and open your own can of whoop-ass and get yourself back to the well one more time. Unfortunately, we are all aware not everyone is so fortunate. Cancer can become a terminal illness. So although it's not advertised anywhere else, there is a final module for sufferers who find themselves in this situation. It's called Accepting Your Situation. And it's there to help sufferers who now find their terminal to come to terms with their predicament by finding acceptance, understanding, and gratitude. The link to this module can be found on the accompanying PDF. So well done on completing this guide. I hope you're feeling much more positive, but more importantly aware of your objectives. This guide is here as a reference for sufferers and their loved ones alike. So please return to it whenever you feel the need. The audios have been produced to not only calm and relax, but also to motivate sufferers to relieve their anxiety and to build that motivation to mend, and of course to maximise the efficiency of their immune system. On a personal note, none of us know what the future holds. Life happens, and that includes the highs and the lows. Part of life is having to deal with those occasional unexpected bolts out of the blue. Experience has taught me that when faced with unexpected events, the best approach is to sit down, carefully consider my options, get advice if I need to, work out a plan, and then hit it head on. So with that in mind, I wish you and your loved ones the best for the future. Stay positive. The end.